here we go. Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you for joining us again, Doctor.
Hi again.
So my name is Dilshad Burman, and I am a writer and reporter with CityNews and 680 News, and I will be moderating this chat today. Now, we've had questions coming in all week for the doctor. Of course, if you haven't had a chance to submit your question yet, you can do so into this live broadcast, and we will try to get to as many as we can. So, Doctor, shall we get started?
Let's go.
Okay, wonderful. So this week we've got a real mixed bag of questions, so I'm just going to take them one by one. Let's start with this one from Anne. She asks, is it safe to invite a family member into your home if they have tested negative for COVID-19? Do they need to take precautions before and after testing to ensure the accuracy of the test? She's thinking more about her kids coming home for Christmas.
So we don't recommend using testing as a guide to say that you're not infectious or it's safe to be around someone. We saw in the summer many times when people used testing as a license to say, okay, I tested negative, now I can go to this cottage, now I can go to this person's house, now I can have a sleepover. And we saw at times when a negative test didn't necessarily mean that someone was not brewing, wasn't incubating, and could still pass on the virus. So definitely do not recommend using testing in that way. Testing actually is not even available in that way. You're the very limited types of people who actually can receive the test. If you're talking about a student, say, who's away, who's coming home for the holidays, we have to think carefully about how to do that carefully, because we want to make sure that when they're away at university that they're taking precautions, and so that they're not likely to catch it when they come home. And so things like distancing, wearing a mask, even the 2 weeks before they leave the university to make sure that they kind of self-isolate when they're there before they come home are also all kinds of considerations we can think about.
Okay, so I suppose people can come home for Christmas, but there has to be all of those layers of precautions taken before and after.
I think we should think about it as someone who has recently traveled.
Right.
And when someone returns from travel, they self-isolate for 14 days. And we're going to have more guidance closer to the day, but that's the type of idea that we should think about when we think about the risks and what kind of precautions we can take.
Okay. And we actually have another Anne question from another Anne. Can you please clarify? There are so many questions about the latest rules with regards to masks and safety. So firstly, she says, is it okay to be with someone if you are wearing a mask and less than 2 meters apart? Or is it okay to be more than 2 meters apart and not wear a mask? So those are her first questions.
So we definitely recommend now that you wear a mask all times when you're indoors, whether you can maintain a physical distance or not, and especially outdoors when you can't maintain that distance. Even with a mask on, you can still spread the virus. The cloth masks are not foolproof. Droplets can pass through them. We don't always wear them properly. And so you cannot think, okay, I have the mask on, now I can get really close to someone. It gives you a bit more protection, but it's certainly not foolproof. So that's the one thing. If you are more than 6 feet apart, I mean, the idea is that the droplets spread for 6 feet. But again, that's not foolproof as well, depending upon if you're yelling, if you're exercising, maybe the droplets might spread more than 6 feet. And so the better protection is to wear the mask. The other thing is when you're two people spread apart 6 feet, you inch in, or, after you have that interaction, then you go and you do something, and you might forget to wear your mask when you should be wearing it there. And so that's part of the reason why just keeping the mask on is what we would recommend.
Okay. At all times, irrespective of distance at this point.
It's the best protection in all scenarios. So I would recommend that you be more cautious and wear it. Yeah.
Absolutely. And then she has a few more questions. Is it okay to work behind a plexiglass shield and not wear a mask?
There's new regulations in Ontario for workers that require all workers to wear a mask, and it includes that if workers are behind a plexiglass shield in a public area, that they're required to wear a mask. So I think you'll have to check with your employer to see what the requirements are there.
Okay, plus it's just safer, you might as well.
Well, the other thing is you're not going to stay behind the plexiglass forever. You're either going to get up and go to the bathroom. If you're a driver, you're going to open it and check something. If you're behind a grocery store, you know, at a grocery store, you may be doing other things. And so that's why, again, you may forget to put the mask on in between, transitioning in between. And that's another good reason to keep it on.
Right, absolutely. And here's another question. Now that we are moving to indoors, can we sit in the garage 6 feet apart with the garage door and side door open to share a meal?
To share a meal with you. I mean, with your household members, you can have that meal inside as well. You know, outdoor dining is permitted with precautions. And so I think that's the point here. We still have to recognize that even if you have a meal outdoor in a garage with the windows open, if you're not keeping that 2 meter distance, despite how many windows you have open, you can still spread the virus. So I think that we have to really be mindful of the other ways in which the virus can spread. It's not just outdoors is always safer. The virus has spread outdoors for sure.
Mm-hmm. Absolutely, absolutely. And like you said, it depends on who you're having that meal with. If it's going to be your whole neighborhood or it's going to be other people, then there's a whole lot of ways you can transmit it, right? And among more people.
That's right. Yeah, yeah.
Okay. Actually, we've got a few coming in live right now, so let's take those. Jenny Gray says, I have had a cough for about 4 weeks, but no other symptoms. Could it possibly just a cough like the good old days?
Of course it could just be a cough. I mean, I always, in Emerge, when I see someone with a cough, I always try and figure out what is it? Is it a postnasal drip? Is it some reactive airways? Usually there's some trigger for the cough. So if it's allergies, you treat the allergies. If it's postnasal drip, you treat that. If it's reactive airways, like a bit of an asthma or your lungs are kind of irritated, you can treat that with a puffer. And that usually can treat the cough. I think though, when we're in this stage of COVID, if we're not sure, the cough has changed somehow, or now you have a runny nose with it, some other new symptom, well, that might be an indication for you to get tested.
Okay. And then Ruth Castellanos says, can you talk about the long COVID long haul symptoms? There's thousands of us and not getting enough recognition and help.
Yeah, I mean, absolutely. I think, this is something that's been identified that we're keeping an eye on. Once you have COVID, these long haulers are people that then can have symptoms that can linger for a long time, and some of them can be quite serious, and that can definitely impact your health. And it's not uncommon to COVID. We've seen this with other infectious diseases, West Nile virus, SARS, other kinds of infections that can impact the body. While you may be cleared of the infection, maybe you're no longer contagious, it can still have long-lasting effects on the body. And this is another good reason why preventing COVID is actually really helpful, because we don't know who may end up with these kind of long hauler symptoms.
Absolutely. And like you've said, it's not just about the older population, even the younger population. You might get over it, but then we don't know what those long-term effects are.
That's right. And one of the long-term effects we know well, we actually talk about it, is you can actually have a cough that lingers. You know, the other person talked about a cough. You can have a cough that lingers for 6 weeks. That's the case with a lot of viral infections, including COVID. Right.
Another one that's coming in live right now, then, Chris says, we all know there are higher numbers. However, we're also doing 5 times the amounts of tests, and it seems like the percentage of positive cases are actually lower. Do you not think that in March we would have had those numbers even higher had we been doing, all of those tests?
Yes, it's hard to know what exactly the picture was in March because we weren't doing as much testing. We were doing a lot of testing through the summer, though, and about 30,000 tests a day. We've been keeping an eye on the number of tests we've been doing. In the fall, we've been doing more tests, but the more tests you do, the percent positivity, that's the number who are positive from the test, has gone up, but has not gone up substantially. We were, maybe 1 to 2% at the beginning of September. Now in Toronto, we're at about 3%. So And looking at the rates, if you look at the cases across the city and where they're distributed, I mean, you're still seeing patterns. And so I think it's fair to say that the cases are up. The percent positivity is up. We're seeing more cases spread. What we can say compared to March, though, is that it tends to be younger people. In March, in the spring, we had more older people who were getting sick. And when they got sick, they were getting very sick.
Absolutely. So overall, though, then in terms of percent positivity, we are seeing a rise in cases again.
We're seeing so we're seeing the percent positivity means of 100 people who get tested, 3% or 3 out of 100 will come back positive as COVID. That's in a nutshell what that means. And so before it used to be out of 100 people who got tested, 1 or 2 were positive for COVID. So we're starting to see more people who actually have symptoms and are coming back positive. We've seen in some places in the US percent positivities of 10%, and we certainly don't want to get there. And so it's certainly going in the wrong direction, but it does mean that the virus is continuing to circulate in the city.
Right. Okay. And then Michael has a question about hospitals. He says, of all the places you would think that hospitals would be most prepared and with the effective safety protocols, but as of Sunday, we were hearing of widespread outbreaks in the hospitals, including St. Joseph's and Toronto Western. So are our hospitals really prepared to deal with the second wave when they can't even protect the wards within their own walls?
There's no question that we know in hospitals what works. We know how to prevent the spread of this virus. That's how we've been managing, actually. But there's also no question that in order to prevent the spread, we all have to keep those public health measures in place, so those infection control measures in hospitals. And hospitals are run by people, just like you and me. And so we can all lapse in our procedures, just like anyone else can. Healthcare workers can do that as well. And that's usually how you end up seeing some of the spread in these settings. We also know that the more spread we have in the community, the more it's going to come into these places like hospitals, like long-term care, like schools, which is why our best protection for these institutions is actually to keep the infections low in the community.
Right, absolutely. And like you said, if it's out in the community, it's going to be in schools, it's going to be in the hospitals, it's going to spread everywhere because people go everywhere.
That's right. That's right. And it's spread by people. Yeah.
Right. Okay. And so a related question then, Michelle asks, my husband is scheduled for a hip replacement on November 12th at St. Joseph's. Should we be worried about the outbreak that is going on presently at the hospital? Should we cancel and, reschedule till when things settle down?
I have complete confidence in our hospital system, in the infection control in the hospitals. A hospital like St. Joe's is massive, and just because they have some cases related to some parts of the hospital doesn't mean that the whole hospital is at risk. And so I think what you are more likely to see is if the hospital was concerned about the cases, they would be more likely to cancel it as well. So I still, though, would recommend that you could connect with your surgeon if you have questions or concerns. But I don't think hearing about cases related to a hospital should make us second guess if we need healthcare. And I think that's really important. If you need to go to the emergency department, go. Like if you're sick, go. Don't delay, because we saw that in the spring as well. And so there are precautions in place. And when you go there, make sure that you take the precautions. Wear the mask, wash your hands, keep your distance from other people who are there as well.
Right. We can't just write off entire institutions and hospitals because of those cases. Like you said, hopefully they're being contained. It's not the whole hospital. It's a large space. So ideally, other functions of the hospital can continue as normal.
Exactly. And hospitals are implementing measures to further prevent spread when they have cases identified in the hospital.
Okay. And this is a question about testing at pharmacies, actually. Leah says, when the pharmacy started doing the testing, everybody was being assured that it's safe. But when she went to a pharmacy, she was really shocked because there was no separated area. It just felt like a really flimsy plastic shield was put between where people were getting tested and a bunch of other vulnerable people around right next to her. So she says, is anyone going and checking how pharmacists are conducting these tests and how safe it is?
So
Sorry, we just lost you for 1 second there, doctor. Just a couple of technical difficulties. There we go. Okay. Oh, you're on mute. You're muted right now.
Okay, sorry. Okay, sorry about that technical glitch. Yeah, we've had a lot this morning, haven't we?
Right.
So we do have to make sure that we are taking precautions in pharmacies. And if you're concerned about a particular pharmacy, I think it's important to note. You can raise it to the pharmacy itself and to say what protocols do you have in place. Ontario Health is the organization that's the lead for testing, and so you could notify them as well to say that you have a particular concern about this particular place.
Okay, because they do have to take all of the precautions. And I mean, testing for COVID, again, there's people who potentially have it. So there has to be all of those protocols in place.
Yes, it is important to know that if you get tested in a pharmacy, you're not supposed to have symptoms. Like, there are very clear people of who are allowed to be tested in a pharmacy. But yes, the reason why you're getting tested is there could be a possibility that you could be positive. And so there's no question that precautions have to be in place.
Absolutely. Some more coming in live right now. So let's take those. Joy Abba asks, after you got a positive test and you have no more symptoms after 14 days, does that mean it's not contagious anymore and the virus has cleared your body?
So most people who are otherwise healthy, if they have COVID, it's actually 10 days now. So from the day that your symptoms started, you're contagious for 10 days after your symptoms started. You're contagious actually for 48 hours before your symptoms to 10 days after. And after that, most people are cleared. They're no longer contagious. The exception is if you were hospitalized, you had a very severe illness, or you have an extremely weak immune system, then it may take longer for you and you may be contagious for longer.
Okay, and then another question coming in live right now. What is the risk of getting COVID inside an elevator? Irene is worried about the aerosol spread, even if no one's inside.
So what we know about the aerosol spread, as we understand it, is the droplets from talking, sneezing. It's those tiny droplets that may be suspended in the air for a little bit longer compared to the larger droplets that fall because of gravity. And in a place like an elevator, that's why we recommend that everyone wear a mask in an elevator, that you keep your distance. If you're worried about those droplets in the air, again, with the elevator opening and closing, that ventilation, that exchange of air is going to help to, if there are small droplets, to dilute. And with you wearing a mask, that's going to be helpful to prevent the spread as well.
Okay, that makes sense. And then RS asks, what is the lifespan of disposable blue non-medical masks after it has been used once? She says, they say that they see tens of them hanging on every car waiting to be reused. I see people now hanging it off their rear view mirrors as just another thing to take with them. So what is the lifespan of that mask?
So you'll have to check with your mask because each mask is obviously made different. In a medical situation, in the hospital, we do have policies where you could wear the same mask for the whole day, as long as it's not dirty, as long as you use it properly. Some of those masks, they're certainly disposable, so they're not meant to be used for days and days on end. And I would certainly say after a day's use, should be thrown out.
Okay. And let's see, Shannon asks, again, this one is coming in live. She says, what about the people who didn't endanger others by not wearing masks? Are they being fined? Is there any enforcement?
So there are regulations in place for masks and for wearing masks. And there are enforcement in place for all kinds of different parts in the regulation. I think the more important message, though, rather than the fines and the regulation, is really that we're all wearing a mask to protect each other. We're all keeping a distance to protect each other. And so sometimes it's more effective for people that who don't wear a mask is to talk to them about it, to explain to them why it's important, because that may actually be more influential than, say, giving them a fine. And so I think that's something that we can all do.
Right. Okay, Liz asks, as it is cold and flu season, how can we know if we have cold symptoms or COVID symptoms? And also, should we be staying home for at least 24 hours after the symptoms start? She says workplaces are certainly eager to have their staff back.
Yeah, you actually cannot tell one symptom from another unless you get tested. And that's one of the reasons why we're actually recommending flu vaccine, because if you can prevent the flu, that's going to be one less symptom or group of symptoms that you will have that you don't know, is it the flu or is it COVID? And so if you have symptoms, even one symptom, you're required to stay home and get tested. And even if your symptoms get better in 24 hours, don't go back to work. I've seen cases of COVID that have had mild symptoms, just a runny nose, didn't think much of it, went away, and actually days later got tested and it was COVID. So you cannot disregard the symptom, and unfortunately, testing is our only way to differentiate that.
Okay. And so then Priyanka has a sort of related question to the flu vaccine. She says, given that the flu shot has dormant viruses that in some cases can cause the candidate to get a flu, is it a wise decision to get the flu shot? Won't it make people more weak and more vulnerable to COVID?
So the flu vaccine that we have available does not have the flu inside of it. It has pieces. It's like an arm or a leg, a protein, an antigen, that kind of thing that's in the vaccine that stimulates your immune response. So the vaccine itself cannot reactivate and give you the flu. It's just not possible. You're not getting the flu from the flu shot. What you're getting is pieces of the building blocks of the virus to stimulate your immune system so that if you were to actually be infected with the flu, you would be able to fight it off.
Okay, that makes sense. PD has an interesting question. They say, I have read that for the flu shot to be most effective, you should sleep well, and the lack of sleep somehow reduces its effectiveness. Is this true? And if so, can you explain why?
I have not heard of that. I mean, I'm sure that sleep is very important for health. I know that. And I know that it's probably linked to good immunity as well. I think there's no question that sleep plays a very important role in our life. But I haven't seen any studies to say that those who've had a good night's rest after their flu shot get a better immune response compared to those who don't. We do know that the older you are, you may have less of an immune response. Even the younger you are, you may have less of an immune response as well. And so boosting that immune response for whatever would do that is certainly helpful.
Okay, and then we have another question about the flu vaccine coming in live right now. Slightly different angle, but maybe we've already answered it. We'll do it anyway. Robin asks, does the flu vaccine make you more susceptible to COVID-19?
No. So there's no indication that if you get the flu vaccine, that if you were now exposed to COVID, that you are more likely to get a COVID infection. So that has not been shown or been proven. We know that the flu vaccine itself has about a 50% effectiveness against the flu. And so I think certainly if you can prevent a flu virus, I mean, there's no question that you could probably get two viruses as well. We've seen older people who have multiple viruses. And so that might help actually prevent you from getting infected and getting sick with COVID if you were exposed to both.
Right. And then Shay asks, if the virus has not yet been isolated, what exactly are positive tests showing? Is it cold flus? Is it proteins from a previous cold? How do you test positive for a virus that has not been identified?
So the virus that causes COVID is called SARS-CoV-2, and the tests that we use most commonly are a molecular test. They look for a piece of the gene of that virus. So we do know what that virus genome looks like, and so that's what the virus tests for. And so it tests to see if you have that gene, or a part of that gene. That gene is very different from a cold, a flu gene, and that's how we know that if it's positive, it's COVID.
Right. It has been isolated. Like we know exactly what we're looking for in the test.
That's right. Yeah. And each of the tests there are a number of different tests out there on the market, and they're not all the same. Some of them may look for different parts of a genome, a different part of this or that. So not all of the tests are the same, but that's essentially how they're working.
Right. And then this one, we've had this before, but I think people are still continuing to be concerned about schools. Concerned adult says, why are schools allowed to pack kids in classroom with little distancing? Why is it acceptable for children and teachers, but not in any other private or public buildings?
So, you know, it's always a good question because it's hard to understand, but the way to understand it is that that classroom, that cohort is not just sitting around a dinner table and having a meal. They're in class following public health precautions. The teacher is wearing a mask and a face shield. They're keeping their physical distance. They've been screened. All of the students have been screened before they enter. They're keeping a physical distance as much as they can. They're all wearing a mask. And so it's those precautions, those public health measures that they're taking in the classroom that makes the risks lower. It's not without risk. And that's why if someone in the classroom has COVID, the whole cohort does go home to isolate. But the risks are what we call mitigated. We're trying to balance the risks because we want kids to be in school. We know that there's a benefit for that.
Right, absolutely. Bora asks, are early treatments and therapeutics being tested? They say that the combinations are prescribed by family doctors in places like Korea and Japan, and they've had great results. And they say it would alleviate the hospitals and ensure that people get care before they deteriorate.
So we do wait on Health Canada to approve medicines that can be used in Toronto, in Canada. They have to be licensed, and the licensure makes sure, first of all, to check to see, does the medication actually work to do what it's supposed to do, and how safe is it? And so that's what I would rely on, Health Canada's review and approval, before I would consider using or prescribing a medication. There is an antiviral medication that actually is licensed in Canada that is being used for very severe cases.
Okay. And then this one comes in from Anonymous. Are there any city-funded mental health resources for those who have depression or anxiety related to COVID?
There are definitely a number of mental health resources available. And if you're not, like, if you don't have a healthcare provider to go to, you could call our Toronto Public Health number to get information. You could also call 211 to get some information as well, because there are a number of resources that are available. So you should never feel like you have to suffer silently at home alone. There are also helplines that you can call. Telehealth is another good one. So there are definitely a number of places that you can call to find what resources would be best for you.
Okay, wonderful. And on that note, we are at 1 o'clock. That half hour went by really fast despite technical difficulties. So thank you again, Doctor, for joining us. If we didn't get to your question, we're going to try and squeeze it in next week as usual. So Doctor, we will see you again next week.
Okay, thanks. Bye-bye.
Thank you so much. Bye-bye.